how to manage your medical bills and debt. I know this is a hot topic for many of us as we kind of navigate the healthcare system. So I wanted to just kind of go into a little bit more detail on how to read medical bills, how to handle medical debt, and how to file appeals if you have a question about a medical bill. So again, I am Natasha Taylor. I am the Senior Director of Policy and Access with Georgia Watch. And first, I want to just tell you a little bit about our Health Access Program. We seek to ensure and expand access to safe, quality, affordable healthcare for all Georgians. We offer direct assistance through our toll-free helpline, educational resources, and workshops such as this one. We encourage the adoption of hospital policies that prevent, reduce, and eliminate medical debt, especially in communities of color, with an aim to promote economic security and increase access to care for all Georgians. We seek to build community capacity to engage in civic advocacy to ensure that community health needs are adequately assessed and addressed, and to eliminate racial disparities in access to healthcare services at the local health system level. So we provide consumers with practical information for managing medical bills with our consumer guide to medical billing and debt, which I'll talk more about later on in the presentation. We promote hospital accountability to ensure that they are providing affordable services to all members in the community, and also providing financial assistance plans to people that may need more assistance. And then encourage the adoption of hospital policies that prevent, reduce, and eliminate medical debt. So an overview of today's presentation, we're going to go through the introduction, which I just did, and then we'll talk about before you make a doctor's appointment, an explanation of benefits statement and how to read that, how to read your medical bill. We'll talk about medical debt and your credit report. We'll talk about filing an appeal with your insurer. We'll talk about paying your medical bills, filing for bankruptcy, debt collection and your rights, and then a conclusion. Before I get started, I just want to make note that the information provided is not a substitute for legal advice. Georgia Watch encourages anyone in need of help on these matters to seek legal counsel. So let's talk about medical debt, and we'll start with the bad news first. Healthcare costs are higher than they have been in the past 50 years. Consumers are paying higher and higher health insurance premiums and out-of-pocket medical expenses. Healthcare costs are a struggle for both uninsured and insured consumers. Increased healthcare costs are high medical debt, and healthcare costs are the #1 reason that people file for bankruptcy. The good news is medical debt is not beyond your control. You can learn to manage and minimize your medical debt. Through this medical debt seminar, you can find answers to some of the basic and most complex questions associated with medical billing and debt. So before you make a doctor's appointment, you have a right to get clear, simple financial information about your healthcare services and bills. Ask questions and get answers. So call your doctor's office and have them find out how much your copay might be if you have insurance. If you don't have insurance, ask them how much that visit is going to cost you. If you have an idea of what tests might be needed, or if your doctor has an idea, you can ask for an estimate of charges for any tests or procedures that you might be getting prepared to have. So give your doctor's office a call and let them know that you would like to be prepared for whatever bill you might be presented with when you get to the counter. Sometimes it's very daunting when you go to check in and all of a sudden you find out you have a higher copay than what you were expecting, or you have to pay in full before even seeing the doctor. So it's good to know that ahead of time so that you can prepare. You also can communicate with your insurer. You can contact your insurer if you have insurance and find out if the healthcare service that you're getting ready to have is free. Most preventative services are free. Screenings, checkups, patient counseling to prevent illness, disease, or other health problems, all of those are supposed to be free services. So check with your insurer and make sure that that you will not have to pay out of pocket to have those services done. Also, you want to check, is there a copay or is there a deductible? Again, knowing these things ahead of time can help prepare you for your visit. You want to ask your insurer, what does my insurance cover? So you want to have a clear understanding of what your deductible is versus what your copay is. So your deductible is how much you owe for services that your insurance would typically cover before your health insurance begins to pay. For example, if your deductible is $500, then your plan won't pay for any services until you've met the $500 deductible. Many plans have separate in-network and out-of-network deductibles. So again, communicate with your insurer and find out what that in-network and out-of-network deductible is and how close you are to meeting that. Your copay is a fixed amount that you pay for covered healthcare services or prescriptions, usually when you receive the service. For example, $25 for a visit to a doctor's office. And then this amount can vary depending on the type of service that you're getting. So if it's a specialist, sometimes that copay will jump up to $50. Same for prescriptions. You can communicate with your insurer ahead of time. If you know that your doctor is calling in a prescription for you, oftentimes while I'm still in the doctor's office, I'll ask them, what are they about to prescribe? And I'll get on the phone with my insurer to find out if they cover that medication. Because if they don't, the doctor can often prescribe a different medication that is covered. And it's really a pain to have to deal with that after you leave the doctor's office. So most often, if I'm in the office and I know the doctor is getting ready to write a prescription, I'll say, give me just a minute. Can I get my insurer on the phone so we can find out what is going to be covered and what's going to be the most affordable for me? You also want to ask your healthcare provider, am I in network or not? In network is when the healthcare provider has contracted with your insurance company to accept certain negotiated or discounted rates. Out of network means the healthcare provider has not contracted with your insurance company to accept certain negotiated rates, and you may be responsible for additional costs. You want to keep this in mind, even if you're going to a facility where all your services are in the same building. For example, if you go to Emory Healthcare and that's where your primary doctor is, and they send you for a certain test or for an MRI or CAT scan, that provider that's providing that service, whether it be the CAT scan or the MRI, might be considered out of network. So you want to ask that question before that test is done to make sure that you're not having to pay more money out of pocket. So just because they're in the same building does not mean that everybody is in network. So always verify. You also want to ask your healthcare provider, why do I need this test or procedure? And ask how much the service will cost. You have a right to ask about healthcare charges before you visit a doctor. And this is particularly important if you don't have insurance. If the service will involve outside labs or doctors, be sure to find out whether those providers are in network with your insurance plan. And then compare costs. You can use trustworthy websites like healthcarebluebook.com and fairhealth.org to compare your cost. So you don't always have to go specifically to where your primary doctor might refer you to. You can always try to shop around and see if someone will offer that service or that procedure at a lower rate. And then you also want to ask about the rate for insured patients. Patients with insurance are often charged less. If you are uninsured, ask for the rate that the insured in-network patients pay for the same care and ask to have your rate lowered. You do have the right to negotiate your rate down to something that's more fair and equitable. So now let's talk about your explanation of benefit statement. Oftentimes we'll get a statement from either the hospital or our medical care provider, and you often sometimes can feel like it's a bill. You'll see some large charge on there, and it can often make all of us nervous about, oh goodness, I did not know that I had to pay all of this money. But your EOB statement, explanation of benefit statement, is not a bill. And they just recently started kind of trying to put that at the top of that statement to say this is not a bill. But that's just something that your insurance company mails to you to explain how much your healthcare provider is going to charge your insurer. And it explains how much the insurer is going to pay. It also explains how much you have paid or may have to pay. And that usually includes your copay, your deductible, or any other balance that might be due. So typical information in your explanation of benefit statement is your name, the enrollee name, your patient number, your claim number, your date of service, your place of service, the customer service contact information, your CPT codes, and your CPT codes stand for current procedural terminology. So those are just codes that offer doctors and healthcare professionals a uniform language for coding different medical services and procedures. So this just kind of streamlines reporting. And then your reason codes, your date of process, your charge amount, your allowed amount, your payment amount, and then the amount due from patient. The main thing you want to pay attention to here, pay attention to on your EOB statement is the amount due from patient, and then the CPT codes. You want to see what exactly you're being billed for. So here's a sample explanation of benefit statement. And again, you can see here where your member ID would be, your patient name, and then you have your date of service, your service description, your provider charges, your allowed charges. So this is what a typical EOB statement will look like. So what do you do when you get your EOB statement? You want to compare that to your bill if you receive a bill later. There should be no differences or duplicate charges. If you see any differences or errors, you will need to contact your insurance and perhaps your provider to challenge those differences. You want to keep your EOB statement and file it for at least a year, and then shred any old ones to protect your personal information. If there is an error in your EOB statement, you want to call your insurance company's customer service number, which is listed on the EOB, and tell them your concerns. If your insurer tells you to follow up with your provider, you want to follow their advice and call your provider's billing department. If you suspect any fraud or upcoding or duplicate coding or unbundled fees or billing for unnecessary services or services that you did not receive, you want to contact your insurance company's anti-fraud department. When you receive your medical bill, if you do, in the mail, after you receive your EOB, you want to understand typical terms that are going to be on your bill. So you'll have the charge, which is the amount that the healthcare provider has decided to charge for the service, the amount paid by the insurance, which is what your insurance has paid to your doctor's office or your provider, your balance due, that's the amount that you now owe the provider, and then any adjustment, that is the amount that the healthcare provider has agreed not to charge, often due to the contract that they have with your insurer. And this is a sample of what your medical bill might look like. So again, you have your date of service, your description of service, your charges, any adjustments, what your insurance paid, and what your balance due is going to be. So what do you do with your medical bill? You want to find out who sent the bill. One care visit can lead to many different bills, especially if you're dealing with specialists. So you want to make sure that you're not getting like 2 or 3 of the same bill and paying more times than you need to. So make sure that you know where that bill is coming from. You also want to find out if the bill is overdue. If it is, you can take action as soon as possible. Call your healthcare provider, contact their billing department, and most often they will offer financial assistance plans or allow you to make payments towards the bill. Don't neglect getting service or neglect paying the bill out of a fear that you have to pay it all in full. Most providers will always offer a financial assistance plan as long as they know that in good faith you're going to be making payments towards that debt. You want to know what is the bill for. If you don't know, if there's some random test that isn't clear to you, you want to call and ask for an explanation of the charge. And you also want to know the details of the bill. If unclear, you can always ask for an itemized bill with the CPT codes. People often do this if they've had surgery and they have a large anesthesia charge. Sometimes you can ask for a detailed account of that bill, an itemized bill with the codes, so that you can kind of match up what you remember happening from the procedure and what you were told was going to happen with that bill. So if there are errors in the bill, you want to check and make sure that the CPT codes in the bill are the same as the CPT codes in your explanations of benefits statement. You want to check for any marked up supplies like gowns, gloves, etc. You want to check for operating room overcharges. As I said before, compare your anesthesia record with your bill. Are you being billed for 5 hours of anesthesia, but you know that you were only under for about an hour and discharged before that 5-hour time frame was up? You also want to look for any unbundled fees and upcoding. So again, any additional fees that don't make sense to you based off of the procedure that you had done, and any duplicate coding. If any medical bill errors exist, you want to contact your medical provider's office and talk with them and have them try to explain the bill a little bit more to you if something doesn't make sense. If you still have questions, you can always contact your insurer. You can request a corrected or adjusted bill if you have talked with your medical provider and it is determined that there is an error. Take detailed notes and keep records of phone calls. Always get a reference number for each call. You want to pay the part of the bill that is correct. So if you're disputing a bill, you don't want to let that go into collections or go into an overdue status while you're in negotiations. So at least pay the portion of the bill that you know that is correct. And then you also want to check your credit report and make sure that that bill has not gone into collections. Medical debt and your credit report. Medical debt can appear on your credit report. Your credit report shows a record of loan paying history, credit cards, debt collections, etc. And lenders use these reports to make lending decisions. You can check your credit report at Annual Credit Report online. You can check your personal information to verify that. Always make sure your name, your social security number, your address, etc. is current on your credit report. Unpaid medical debt is added to your credit report 360 days from the date a medical bill is past due. And that was recently amended thanks to a lot of collaboration between advocacy groups. So now medical debt, you have up to a year to settle your medical debt before it is reported to your credit report. This gives you time to receive and pay the bill. If it does end up on your credit report, it should be removed after it is paid. It should not remain on your credit report. If you do see any errors on your credit report relating to medical debt or any other debts, you can file a credit bureau dispute if there are any errors. If you need to file an appeal with your insurer, you have the right to do that. If you think your insurer should have covered a service or an item, you can file an appeal. Ask your insurer to reconsider its decision not to pay for a certain portion of your care. There are 2 levels of appeal. You have an internal appeal and an external appeal. Your insurer reviews its payment decision in a full and fair way. You have 180 days from the time you find out your claim has been denied to file an internal appeal. With an external appeal, if the insurer still decides that they will not pay for the service, then you can ask the Georgia Department of Insurance to review your claim. You have 60 days from the results of the internal appeal to file an external appeal. So again, the steps in the appeal process. Step 1, you want to file an internal appeal. Step 2, wait for your insurer's response. And then if they deny that internal appeal, step 3, you can file a complaint with the Georgia Department of Insurance. Now, when it comes to paying your medical bills, you want to take a close look at your finances. Know your financial situation. You want to create a list of other debts and bills and figure out which to pay first, i.e. your mortgage, rent, utilities, taxes, child support, etc. You want to try to manage those debts if you're having to seek medical care and have a clear understanding of what you can afford. That way you can negotiate terms with your medical providers. Also, as much as you can, try not to put medical bills on credit cards. Credit cards have high interest rates and harsh late penalties and often force you into a deeper cycle of debt. So again, it's always better to try to work out a payment plan with your provider instead of putting it on a credit card and now you have to pay that debt plus interest. If you cannot afford to pay the bill, again, call your provider, negotiate to pay a lower amount. When doing that, you want to be polite and persistent. Know the typical cost of procedures. If you have a question about the typical cost of procedures, again, Sarah gave you the number to our consumer hotline. We are always here to help you with that or refer you to resources that can help you in your area. You want to know the medical terms, and if you don't, it is fair for you to ask what the medical terms mean. You want to request to pay a lower amount, and if they can't lower the amount, or even if they can, you want to request a payment plan. So here's a financial assistance checklist for you. Check your bill and or the provider's website for any notices and any information about a financial assistance policy. Contact the provider's financial counselor or the billing office to ask about whether the provider has a financial assistance policy. And if they don't, you can always seek care at another provider that does. You want to ask the provider to write off, forgive, or cancel some or all of the bill. Many offices, billing departments will do this based on your financial situation. So if you're receiving mainly Social Security or on a limited income, most often billing departments will write off or forgive some or most of that debt. You can ask to get any financial assistance agreement in writing, and you can also follow up to make sure the bill is not on your credit report. If you need help paying your medical bills, we have the Indigent Care Trust Fund here in the state that you can contact, the Department of Community Health. There's retroactive Medicaid eligibility, the Hospital Bills Assistance webpage, and then there are some legal services that focus on consumer assistance programs. Remember, you have rights, and we are here to help direct you to all of those resources. When it comes to debt collection, you have rights. A debt collector is a person or a company that regularly collects debts owed to others, usually when those debts are past due. Federal and state laws exist to protect you from unfair, deceptive, or abusive debt collection practices. So the Fair Debt Collection Practices Act prevents debt collectors from calling you at work if your employer does not allow calls. They cannot call you before 8 a.m. or after 9 p.m. They cannot tell your friends or family or coworkers about your medical debt. They cannot be harassing, threatening, use obscene language, or publish your name in a list of people who owe medical debt. They cannot make false statements about your debt, threatening to file a lawsuit if they have plans to do so. They can't do that to you. So when you get calls like that, you want to look into those because most of the time those are fraudulent calls. You also want to, they cannot contact you after you have written to tell them to stop contacting you. There are other applicable laws when it comes to debt collection and your rights. The Truth in Lending Act, the Fair Credit Reporting Act, and there are also some helpful resources that can help you when it comes to debt collection and your rights, such as the National Consumer Law Center, the Consumer Financial Protection Bureau, the Federal Trade Commission, and Atlanta Legal Aid. Again, we are here for you at that hotline number if you have any questions or issues in disputing debts or you need help in finding resources to assist you. So in conclusion, medical debt is not beyond your control. You can learn to manage and minimize your medical debt. You have rights. And we also have the Consumer Guide for Medical Bills and Debt that is available on our website at www.georgiawatch.org. And that is a guide that kind of breaks down everything that I talked through in today's presentation and really takes you into how to read your medical bills and how to file disputes, and then how to seek assistance if you are uninsured or underinsured. If you have any questions, please feel free to contact myself at ntaylor@georgiawatch.org. That's N as in Natasha, Taylor@georgiawatch.org. Or again, my colleague, Sarah Phillips at sphillips@georgiawatch.org. Thank you so much for your time.